Your breast milk is important to your baby at any age. Giving your premature baby your breast milk benefits their health as well as yours. Breast milk helps protect your baby from infections, particularly if their gut. Premature babies are more likely to get infections. Contains hormones, nutrients and growth factors that help your baby to grow and develop. Is easier for your baby to digest than formula milk, because it's human milk specially designed by your body for your baby. If your baby is very small or sick, they may not be able to breastfeed from your breast at first. But, you can start regularly collecting your breast milk, called expressing, as soon as possible after your baby's born. This will help get your milk supply going, and the milk you express can be frozen so you can give it to your baby later. Then you can start breastfeeding from the breast once you and your baby are ready. Even if you are not planning to breastfeed, you could express your breast milk for a while to help boost your baby's immune system in the early weeks after birth. If your baby is born before week 37 of your pregnancy, he'll be classed as premature. We don't always know what causes premature birth, but there are factors that increase the likelihood. These include a twin or multiple pregnancy, certain health conditions affecting the mom or fetus, or having had a premature baby previously. Because premature babies have had less time in the womb, they have some extra growing to do, and may be more vulnerable to illnesses and infections. They may also need to spend time in a neonatal intensive care unit, NICU. It's recommended you express often, ideally at least 8 times a day to begin with, including at least once at night to keep your milk supply up. In the early days, it's often easier to express your milk by hand. Your midwife or a breastfeeding supporter can show you how. You'll probably only express a few drops to begin with, but, if you hand express often, this will increase. Even if you are only expressing a small amount, it will still help your baby. In the early days, you can collect your breast milk in a small, sterile cup and store it in a syringe. Once you are producing more milk, you could try using a breast pump. If your baby is in a neonatal unit, the hospital will usually be able to lend you an electric breast pump for expressing your milk. If they cannot lend you one, you can hire one. Babies do not normally learn to coordinate the sucking, swallowing and breathing needed for feeding until about 34 to 36 weeks of pregnancy. If your baby is born before this time, they may need to have breast milk via a feeding tube to begin with. This goes through their nose or mouth into their stomach. The staff in the neonatal unit can show you how to feed your baby this way. Babies who are very premature or sick may need to be fed via an intravenous line to begin with. A fluid containing nutrients is fed straight into your baby's vein. You could also consider using a lactation aid. This is a way of supplementing your baby's breastfeeds with either expressed breast milk or formula. A tiny tube is taped next to your nipple so your baby can get milk via the tube as well as from your breast while attached to your breast. This helps to support your baby as they get used to attaching to the breast. Your breast milk contains enzymes that help your baby with digestion, as well as epidermal growth factor, which in turn helps his intestine mature. Premature babies fed mainly on breast milk have significantly lower intestinal permeability than those predominantly given formula, which means that fewer, potentially disease-causing, particles can pass through the lining of their intestines into their bloodstream. Breast milk is so important for preemies that if their own moms can't, for whatever reason, provide them with enough milk at first, they may be fed donor milk from other breastfeeding moms to bridge the gap, rather than formula.